The number one question I get on my social media is, how can I get bigger? How can I get longer? Or how can I get more girth? Well, today I am going to answer those questions and give you the evidence behind penile lengthening treatments. I'm Dr. Laura, a urologist and pelvic surgeon, and a urologist is a doctor who takes care of the genital urinary tract both medically and surgically. If you like what you see here, make sure you subscribe so you can see new videos each and every Monday. So did you guys know that they did a survey of 50,000 heterosexual men? And what they found was that 55% of them were unhappy with the way their penis looked. When they asked those men's partners, 85% of women were satisfied with the way their partner's genitals looked. But at the end of the day, it matters how you feel about your appearance. And there are a lot of issues with that because pornography has really blurred the lines of what exactly is normal. I made a video before talking about the average penile length, and if you look at all the data, the average penile length is about 5.2 inches or 13.2 centimeters, and it's normal for penile length to be within 2.5 standard deviations of that, either bigger or smaller. What's considered abnormal in terms of length being too short would be anything less than 2.9 inches or 7.5 centimeters, and that's called a micropenis. Micropenis is seen in less than 1%, actually 0.14% of the population, so it's extremely rare. It can be due to many causes, which can include congenital issues, hormonal problems, past surgeries, or cancer, but today we're going to talk about people who have a normal penile length. While it is true that the large majority of people who worry about the size of their penis have a normal penile length based on these numbers, the real issue is that a significant number of men can feel distress related to the idea that their penis is not as long as they want. This is a form of body dysmorphic disorder, and it actually has a name called small penis anxiety. It doesn't mean that they have a small penis, but they have anxiety related to the belief that the size of their penis is not long enough. This is defined as people having a strong focus or obsession with the size of their penis, which they spend over 1 hour a day thinking about. And some of these men can become so upset that it can affect their daily activities. Some can even end up in the hospital due to their overwhelming obsession or have suicidal thoughts. This is not a joke, this is serious, and it can have very real complications for people, which is why I think it's important to talk about this because it is part of men's health. The other major issue with this problem is that if you Google, how am I going to make my penis longer, you will be flooded with tons and tons of websites and information. Information you find online may or may not be trustworthy. Many people will travel abroad or find non-licensed providers to do procedures that can have serious consequences. So please don't do that, and always look for a reputable urologist or psychologist to help you with these issues. I also want to preface the rest of the information I'm going to share in this video by explaining that the Sexual Medicine Society of North America states that procedures for penile lengthening or girth enhancement are not recommended and are considered experimental unless they are done in the setting of someone who has a micropenis. The things I'm about to discuss are found in urology literature and do have some data to support them. However, before doing any of these things, please establish care with a urologist who is familiar with these topics. As a disclaimer, I do not discuss or offer treatment for penile lengthening in my own practice, but because this is such an important topic, I went ahead and reviewed the research for you. There are two main categories of treatment options available to people who suffer from small penis anxiety or distress related to the belief that their penis is smaller than normal. And these include non-surgical treatments and surgical options that are reported in the medical literature. Starting with non-surgical treatments, psychological counseling is very important, as there are validated tools, questionnaires, and assessments that can help you understand what normal penile size is, and also help you manage some of these anxious thoughts. Interestingly, when you look at people who have gone through only psychological counseling and nothing else, the large majority of men no longer want to pursue any other treatment, whether non-surgical or surgical, to increase the length of their penis, and this is very significant. I would strongly recommend that anyone who is struggling with anxiety seek psychological care to help address these concerns. There are 3 additional non-surgical options, which include penile extenders, vacuum erection devices, and penile injectable treatments. Of these 3, the only option that has data suggesting it actually leads to penile length increase is penile extenders. Penile extenders are devices that have an opening where the penis is placed, along with 2 metal rods on each side, and a silicone ring at the end to hold the glands in position. These devices slowly and mechanically apply stretching force to the penis to help increase length, and this process takes place over the course of many months. And this requires a lot of time and daily effort, and when you look at the data, people who consistently use these penile traction devices did gain some length in their penis. Their penile length was measured using flaccid length as well as flaccid stretch length. And in urology, we use flaccid stretch length to estimate erect penile size. The flaccid stretch length has been compared to erect length and has been shown to be very similar for measurement purposes. So, what was the final gain after months and months of daily use? About 2 centimeters. So there was an increase, but it was very small, meaning you have to be extremely dedicated and use the device daily for several hours a day to get this result. There are also some complications, which can include numbness, bruising, or simply lack of results. You can spend a lot of time doing this and see no benefit at all. This is the only option that has been shown in the medical literature to have fairly consistent results with very low side effects. The other options, such as vacuum erection devices, it specifically did not increase penile length at all. Lastly, penile injections have been tried in many different forms, and many of them have led to serious and devastating complications. Because of this, I do not recommend any penile injections. In fact, next week I will be talking more about the history of penile injections and the different types people have tried, including which had good outcomes and which had bad ones. Right now, the data is not strong enough to recommend any kind of injection into the penis, and as I mentioned earlier, complications can occur even up to 40 years after receiving a penile injection, so please do not inject anything into your penis. When it comes to surgical treatments, many different surgical options have been discussed and written about in the medical literature. One of the most common is a suspensory ligament incision. The penis is attached to the pubic bone, which is the bone located in front of the penis, by a ligament, and cutting this ligament can allow the penis to appear slightly longer. However, this procedure is not without complications. There are also other techniques that use different flaps, grafts, and even rib cartilage to try to increase penile length. But overall, these methods have poor outcomes and low satisfaction rates. The studies that report results from these surgeries are often not well designed or thoroughly documented. Because of this, at this time, surgery to increase penile length cannot be recommended, as it comes with many possible complications. The only situation where surgery for penile lengthening should be considered is within a clinical trial. A clinical trial is performed at an institution that has an institutional review board, or IRB, which ensures that studies are safe and ethical for human patients. The IRB also makes sure there is proper monitoring of data and a system to report any side effects or complications that occur during the trial. This allows accurate documentation and publication of results so we can clearly understand how safe and effective a procedure truly is. This is how we, as urologists, evaluate data scientifically to decide whether a treatment has good outcomes and is safe for people. The bottom line is that there is not much you can do to significantly change the length you were born with. You may gain a small amount of length with penile traction therapy, and this has been shown in the literature, but many other treatments are still being studied and are not recommended for regular care. I believe the most important first step is getting help from a psychologist to manage this anxiety before doing anything that could be permanent. Some treatments can leave you with results that are disfiguring, not functional, and worse than where you started. Thank you so much for watching, and make sure you join me next Monday when I talk about penile injections and the side effects and complications that have happened to patients who injected their penis or had substances injected into it. And always remember to take care of yourself, because you are worth it.